Hi everyone, thanks for watching my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. For the past 7.5 months, I've looked forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions to discuss in the next vlog. Optimism is more cautious this week. The New York Times is reporting a 10% increase in cases nationwide over the prior 14 days, while hospitalizations are down 17%, ICU patients are down 26%, and deaths are down 31%. That case rise is driven in large part by the Northeast, and it's important to mention that the rise is from a pretty small number. We're nowhere even close to what we were seeing in January. In Massachusetts, you can see a very clear rise in cases, but a very flat hospitalization rate, even though cases have been rising for about a month now, and even though BA2 now makes up more than 90% of new infections in New England and more than 85% across the country. It's a good sign that we haven't seen hospitalizations rise yet. It doesn't mean that we won't, but I do think it won't be dramatic if we do, because we're probably near the peak of the case bump if we assume that we are, as usual, a few weeks behind Europe. Last week, the FDA's advisory panel met to discuss the plan for boosters going forward. There was not a lot of consensus among the members, unfortunately. Unlike what we do with influenza, it's just so hard to predict in advance what variant it would be best to make a COVID vaccine against, which really highlights how important it will be for vaccine developers to figure out how to make variant-proof vaccines. Our first question is from Helene from Lexington. COVID cases have been ticking up in Massachusetts for several weeks now, but we've not experienced the type of surge that we have in the past. At what point can we safely say we are in the clear from a BA2 related spike? Well, I will breathe a sigh of relief when I see the wastewater levels peak and start coming down, and that's not happening yet. We're usually a few weeks behind the UK, and they peaked around March 23rd, so it should happen soon. But again, I'll point out that when you include January in the graph, what we're seeing now is nowhere near what we were seeing then. And that's despite the fact that the BA2 subvariant is associated with a higher viral load. So there's probably more virus in the wastewater per infected person than there was with BA1. Our second question is from Juliana from Stoughton. With COVID cases on the rise again in the Northeast, I saw Philadelphia is the first big city to announce that it will reinstitute its indoor mask mandate. At what point should Boston consider doing the same? Well, first, let's revisit the CDC guidelines on that. Using the new CDC Community Risk Level Framework, more than 99% of counties in the US are green or yellow, meaning masks not broadly recommended. All of Massachusetts is green. All of Pennsylvania is green or yellow, yellow being where high-risk people are advised to talk to their doctor about masks. Philadelphia is in a green county. So why did they reinstate their mandate? They were using a metric, from what I understand, of 50% increase in cases. The problem is that a 50% increase from a really tiny number is still a really tiny number. Here's the Boston metro area compared to the Philly metro area. Both show really modest rises in cases at this point, and I worry that deviating so far from CDC guidance will erode public trust in public health authorities and will lead to noncompliance and difficulty enforcing the mandate. I also think it's become pretty clear that whether or not a city, state, or country had a mask mandate during the Omicron wave didn't really have any impact on the shape or size of their case curve. Here, as just one example, is Massachusetts, which didn't have a statewide mandate, and New York, which did. And the examples of this are actually endless. So I think we're better off educating people who are high risk on how best to protect themselves, being vaccinated and boosted, preventative monoclonal antibodies for those who qualify, optimizing all health parameters through regular primary care visits, wearing a high-quality mask, testing early and often, and getting treatment right away when infected, now that treatment is widely available. Our last question comes from Cindy from Chelmsford. I read a really interesting article about how ventilation is an often overlooked key to preventing COVID-19 transmission. Is stopping the virus's spread as simple as opening a few windows? The 2022 White House COVID-19 preparedness plan has just 4 elements. The goal of preventing economic and educational shutdowns includes a plan to secure funding to give schools and businesses tools to improve ventilation and air filtration. That includes a clean air in buildings checklist and technical assistance. Now, I wouldn't say that opening a few windows stops the virus dead in its tracks, but it helps. Both ventilation and filtration help. Ventilation means bringing in more fresh air to dilute air that might have virus particles in it. And filtration is moving the air through a filter that physically removes the virus. And the beauty of improved air quality, particularly if done by enhancing a building's ventilation system so that it doesn't require open windows in inclement weather, is that once it's done, it doesn't require effort and there's no downside. It's just running in the background. And it helps not just with COVID, but all respiratory pathogens. Clean air is the type of mitigation strategy that is sustainable long-term, more so than masking and distancing and modifications of normal business practices. So no, ventilation doesn't take away the need for vaccines and treatments, but it does belong in the plan for the new normal. That's all the time we have for this week. You can send me your questions about the Omicron BA2 subvariant, the recent uptick in COVID cases, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. As we move into the spring months, I will be doing the vlog bi-weekly, so I look forward to dishing out a dose of reason to you again in 2 weeks.